Yeah, so this so-called Delta variant, it was first recognized in India. And so this is the one that's really been exploding in India and is now beginning to appear in many other parts of the world. And so what we know so far, including what's happening in Guangzhou, this appears to be more transmissible. And not only does it appear to be more transmissible, it seems to cause more severe disease in people who do get infected. And so this is a concern. And there's some evidence that this variant may not be as responsive to some of the vaccine that have been approved, especially the one from China, the Covax. And so this is something that we may continue to witness in different parts of China unless the vaccination program is rapidly accelerated.
Is there any difference in the treatment, in the medical treatment of this Delta variant?
No, so once someone gets hospitalized or develops a severe disease, then the treatment is essentially the same as with any other COVID virus variants.
You mentioned China's vaccination program. I'd like to get your take on the progress in its inoculation campaign. The country is currently administering about 20 million doses per day. Do you think China can reach its vaccination goals to have most of its population vaccinated by midsummer?
I don't think they're going to be able to do that by midsummer. I think the projection is that about 70% of the population in China will be vaccinated over the next 3 months, which is sort of the level that we want to see because that may contribute to the beginning of what's called herd immunity. But with the sheer population size of China, it's going to be a huge hurdle.
We know that China is trying to ramp up production on its various vaccines and adding more to its COVAX contributions. How important is this in controlling the global pandemic?
Yes, this is very important. I mentioned herd immunity. We cannot achieve complete herd immunity until everybody in the world is vaccinated. And so even if China can achieve its projected proportion of people who are vaccinated, if we can't get others, people in other countries to get fully vaccinated, we're just not going to be able to control this pandemic.
All right, Dr. Lee Riley, thank you so much for joining us from California. We sure appreciate it.
Thank you.